Did you know that your nasal spray could be the key to beating allergy symptoms fast? Let's clear up the facts about Flonase Nasal Spray over the counter. Hello, I'm David from the Pharmacy Corner. I'm here to break down health topics in a clear, simple way with key facts and practical tips. Let's get started.
Flonase nasal spray with the active ingredient fluticasone propionate is an over-the-counter medication used to relieve symptoms caused by seasonal and year-round allergies. It works by reducing inflammation in your nasal passages, helping to ease sneezing, runny nose, congestion, and itchy or watery eyes. According to the U.S. Food and Drug Administration, Flonase contains a corticosteroid that targets the root cause of allergy symptoms rather than just masking them. To use Flonase correctly, follow these general steps based on the package directions. Before the first use, shake the bottle well and prime the spray by releasing a few sprays into the air. Gently blow your nose to clear your nostrils. Then, tilt your head forward slightly and insert the spray tip into one nostril while closing the other nostril with your finger. Spray once while breathing in, gently through your nose. Repeat in the other nostril if directed. Avoid spraying directly onto the middle part inside your nose, called the nasal septum, to reduce irritation. After use, wipe the spray tip and replace the cap. Never share your nasal spray with others to prevent infection. Like any medication, Flonase may cause some side effects. The most common ones include nasal irritation, dryness, or a slight burning sensation inside the nose. Some people might also experience nosebleeds or headaches. These are usually mild and go away with continued use. However, if you notice severe discomfort or signs of infection, it's important to talk to your healthcare provider. The National Institutes of Health reminds us that side effects can vary from person to person. Before using Flonase, make sure to read the full instructions on the package. It should not be used by anyone allergic to its ingredients. People with certain medical conditions or those taking other medications should consult a healthcare provider first, especially if you have ongoing infections or nasal injuries. The Centers for Disease Control and Prevention emphasize that proper use is key to getting the best results and avoiding complications. Remember, Flonase is meant for nasal use only, not for the eyes or mouth. Flonase Nasal Spray OTC can be a helpful tool to manage your allergy symptoms when used correctly. Always check with your healthcare provider if you have questions or concerns. This video is for educational purposes only, not medical advice or diagnosis. Always consult your healthcare provider before making health decisions.
Thanks for watching the Pharmacy Corner. David here. If this helped you understand your health, please subscribe for more clear tips. What health topic would you like next? Stay well.